Cleveland Clinic investigators have found a connection between smoking's impact on how myelodysplastic syndrome, or MDS, progresses in diagnosed patients. This study is the first of its kind to detail specific genetic changes in MDS being linked to a type of environmental exposure. This finding may someday lead to the development of drugs that specifically target these molecular changes. MDS typically appears in individuals over the age of 60 and is part of a group of diseases which are the result of bone marrow being unable to make enough normal blood cells for the body. Roughly 25% of cases are considered to be high risk for progressing toward leukemia. The only known cure is a bone marrow transplant, although chemotherapy and some drug therapies are employed to manage the condition. Led by Dr. Mikhail Sekaris of Cleveland Clinic's Taussig Cancer Institute, a team of investigators employed gene sequencing and analysis of health records and smoking habits of 151 patients treated at Cleveland Clinic for MDS between 2000 and 2012.
We maintain a database of people who were treated at Cleveland Clinic for myelodysplastic syndrome of about 1,300 patients. We looked at what percentage of those patients were smokers and then divided that group into those who currently smoke, have smoked in the past and never smoked, and then looked at the number of pack years those patients smoked. You measure smoking exposure by the number of packs per day a person smokes over the number of years that person has smoked. So someone might have 20 pack years of smoking exposure if that person smoked 1 pack per day of cigarettes over 20 years, or if that person smoked 20 packs of cigarettes per day over 1 year, and we just multiply the two together.
The analysis found two results that were not expected: that the amount of genetic abnormalities rises with age and increases in line with how much a person smokes. The cause of these abnormalities lies in an environmental pathogen within cigarette smoke.
One aspect of our research showed that people who had smoked in the past and had stopped smoking had better survival with their myelodysplastic syndrome and fewer genetic abnormalities than those who continued to smoke and who smoked heavily. So it's not too late to give up environmental risk factors like smoking, modifiable risk factors. Even at a first diagnosis of myelodysplastic syndrome, it may help prevent that myelodysplastic syndrome from acquiring additional genetic abnormalities. It may actually improve survival.